Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. In this video, we're going to be talking about ACL reconstruction. Very common term you would have heard. A friend of yours had it, a colleague had it. So firstly, we need to understand what is the ACL, what are its functions, does it heal properly on its own, does it require an operation, if an operation, what operation, is there physiotherapy? So let's learn everything about it. So what is the ACL? The ACL is a ligament. The full form is anterior cruciate ligament. What is a ligament? It is a rope that connects two bones together. And in this case, the ACL connects the thigh bone and the leg bone. It is right in the center, in the notch of the knee joint. It stabilizes the knee joint in a front direction and in a rotatory direction. So the ACL is not like this, it is slightly oblique, because of which it gives rotational stability. So when the ACL breaks, your knee becomes unstable, it twists and goes excessively frontwards and would need some kind of stabilization. How does it break? It typically breaks due to sporting injuries, falling off from a bike, slip and fall, but injury related. When it breaks, you have pain, swelling, stiffness, instability, which are the main sign symptoms, and it's diagnosed with a MRI and with clinical tests by a specialist like me, who's a knee specialist. Once it's diagnosed, we decide what is to be done. Now we need to understand this ACL. Why is it special? It's special because when it breaks, it gives rise to a lot of instability. And the ACL is intra-articular, meaning it's present within the knee joints. Remember, the knee joint is a vacuum. There are intra-articular and extra-articular ligaments. Intra-articular are the ACL and PCL, extra-articular the MCL and LCL. Extra-articular ligaments have better blood supply and better healing capacity, especially the inner one called the MCL. Intra-articular ligaments have lesser blood supply and more unpredictable healing mechanisms, and the reason is the local milieu. There are various kinds of substances called cytokines, etc., which prevent healing from happening, especially with the ACL. So the ACL does not have much of a capacity to heal on its own. However, do all ACLs require operation? Not really. ACL is basically like the nitro engine in a car. It's required when you have to drive your car beyond 50 kilometers an hour. I was just joking with nitro engine, that's for much faster cars. But just for you to understand, it's for people who are going to be more active in their life. So if it's a young person, potential, may not be sporty, but tomorrow a dog runs after him, he should have the capability of running away from it. If he feels unstable on his knee, he's not able to walk properly, yes, he needs something done about it. However, there's a subset of people called copers. These are people with relatively lower expectations and activity levels in life. Someone who's like 60, 55, who's not into sports, living a normal life, driving, walking, going to the gym, may not require reconstruction. So what you do in these cases is you basically strengthen the compensatory mechanisms like the thigh and hip muscles so that they can compensate for the ACL. They are a compensation, they are not really as good as the ACL, but life can go on at a sedentary pace. However, current literature seems to make us suggest that when the ACL goes, it increases the loads on the knee and can lead to degeneration or arthritis later on. For those who are more keen on being active, younger people, of course, a stable knee is important and a reconstruction may be the only solution. Why do I say that? So ligaments can break in various ways. So ligaments are like clotheslines. They can either come off from one end of the wall or they can break in the middle. When they come out from one end of the wall, you can fix the clothesline back. We call it an ACL repair. I do a lot of these where I basically stitch it back. Great results, but in the right patients. If the ACL breaks in the middle, then of course you can't use the rope again. You need to use a substitute for the rope. So what can you do? One is take a substitute from the body. So you have some substitutes in tendons like the hamstring, quadriceps, patellar tendon, peroneus, which can be used, or now the latest is synthetic ligaments. Why take anything from the body? It has a function in the body. So synthetic ligaments are very popular. I do a lot of both of these. Synthetics have great results with early rehabilitation because it's like if you like apples, you either sow a seed, the seed becomes a plant becomes a tree, and then you get apples. Then you enjoy the apples. Or call your friend in a cold place, transport an apple tree into your garden, sow it and just wait for the apples. So artificial ligaments are like that. They're strong to start with and they get tissues to grow over them. So they have distinct advantages. However, they are more expensive. Long-term wise, both of them have same results. Whether you use a ligament from the body, an autograft, or an artificial graft. Artificial graft has the advantage of earlier recovery. These operations are done through keyhole surgery. Now remember, the ACL may tear alone or tear along with the meniscus, which are the shock absorbers in your knee. And I always repair the meniscus because riding a bike without a shock absorber is a no-brainer. You can't do that. So you need a shock absorber to protect the bike. Same way you need the meniscus to protect the knee. So repairing the meniscus is very important. Physiotherapy is as important as the operation because physiotherapy strengthens the compensatory mechanism. There's no great prime minister who doesn't have a great cabinet. So making your cabinet strong along with the prime minister is very important. And the cabinet of the knee is the quadriceps muscles, the thigh muscles. So strengthening them is very important. I hope you got quite a bit of information about ACL reconstruction through this video. If you like my videos, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a very popular Hindi channel with a silver play button. Please like, subscribe and follow it. Thank you.